Our next speaker is another friend and colleague, another former panda, Taylor Ricketts. Many of you know him. He is the Gund Professor and the Director of the Gund Institute for Ecological Economics at the University of Vermont, which is recently expanding its mandate, which is a sign of success. Taylor is also one of the founders of the Natural Capital Project, really one of the pioneering consortia focused on understanding and applying our ecosystem services thinking. Taylor has won innumerable awards, including being recognized by Thomson Reuters as one of the world's most cited and influential scientists, but not as highly cited as Walter, I'll just say that. So please, Taylor.
Okay, thanks, Steve. And it's a great pleasure to be here. I've watched the Planetary Health Alliance form over years, and I agree with what was said at the very beginning of this conference, that it's a big weekend for all of us. So what I want to talk about is connecting watershed condition to childhood health, looking at global relationships scientifically, but also connecting it to policy in a variety of ways. I just want to start off by saying my name's up here and I'm standing here, but there are 4 people in particular that have done a lot of the work on this project. And those are from left to right: Diego Herrera, Alicia Ellis, Renaiva Rasolifson, and Brendan Fisher. Many other authors, which you'll see at the end, but these 4 have done a lot of the work you're about to see. Okay, so this is the slide that I don't need to show at this point, but suffice it to say that nature and health are related in a variety of ways that we've seen over this conference. But importantly, that environmental burden of disease, roughly a quarter, as has been said, is not evenly distributed on Earth. And that makes connecting nature and health a public health issue, a conservation and ecosystem issue, but also an ethical and distributional one. So it's a really important thing for all those reasons. I think as scientists, this is my picture of what we need to do as scientists to connect policy to this relationship between ecosystems and health. And this is similar to several figures you've seen. This is just our version. And roughly, we need to know how policies and decisions connect to ecosystem changes, cause them, how those changes cause specific ecological effects that produce new health risk factors, and how those health risk factors connect to actual measured health outcomes through that yellow box, which is this mediating factors, right? So that's very vague. Here's an example from one of the most often talked about ones, how, say, forest policy might connect to deforestation and cause it, changing the microhabitat distribution for mosquitoes, changing the abundance of vectors and their population sizes, and causing malaria, except if you have something like bed nets or prophylactics and things, right? So linking policies through the ecosystem changes and the risk factor changes to actual measured health outcomes, taking account of these mediating factors, is, I think, kind of a snapshot of the scientific challenge we have to make our science policy and decision relevant. So I'm going to show you one example of our group working on this, trying again to specifically connect watersheds and waterborne disease. And our question is this one: how does watershed disturbance or condition affect downstream diarrheal disease among children? So diarrhea, as I'm sure many of you know, but I've learned as part of this project, is the second biggest killer of children on Earth. It kills more kids every year than measles and malaria and AIDS combined. So it's a big health outcome that's obviously related to environment. Our approach this way is a big data approach. It's not typically what we do in my group, but we're taking a sort of global multi-country approach using DHS surveys, which are these USAID-run surveys that have been going for many years in about 90 countries, hundreds of thousands of households now. And we had a grant from the United States Science Foundation to compile them for the first time around linking ecosystem services and health. This is a picture of us trying to do that at SUSINC. Several people in this room were in that project, and no, I don't know why that big fish is there on the wall. That's what everybody asks me. That's a story, I'm sure, but it's just there. Here's what the data look like. So every red dot is a cluster of households, 10 to 20 households in each dot, every occupant of that household. After cleaning up all these data, we have a database of about 800,000 children in 49 countries, and we know a lot about them. We know their health outcomes, social factors, sanitation factors, all from DHS. And we've added natural features like climate variables and land use, also watershed conditions. We've drawn the watershed above every kid and asked what's the human activity and forest cover in those watersheds, right? So this is what's setting us up. Here's a picture just from one country to tell you what the data look like in a little more detail. About 2,800 households in Mozambique from the most recent survey there. And we can ask where diarrhea equals yes, right? Where a child has experienced diarrhea in the last 2 weeks, that's the variable of the outcome. Whether they have an improved or unimproved water source in that household. And then from our watershed variables, what's the degree of human activity in the watershed above that household? So these are the variables we're trying to connect in this sort of synthetic, global exploration of how nature and health are related. So how are we doing against this standard I set up? This is how we stack up against this box and arrow diagram. We have variables about upstream human activity and tree cover. We have the outcome, diarrhea itself, prevalence of diarrhea, and then we have a lot of information on these mediating factors, a lot of things we know affect diarrhea. And we're going to try to understand the relationships here. And here is the sort of one and only results slide. So I'll walk you through it. Each of those variables I just mentioned is a row here, and that red line down the middle is a no effect line. And if a symbol is to the left of that line, that factor decreases diarrhea, it improves things. If it's to the right of that line, it increases the probability of diarrhea among kids, it makes things worse. So that top 2/3 of the graph is all those socioeconomic variables that are often related to diarrhea. The two that are interest of us for this particular thing are the bottom two, showing that human activity upstream, when there's more of it, there's a higher probability of childhood diarrhea in the clusters and households, whereas higher tree cover, higher forest cover upstream causes a decrease, a measurable one across all these different countries and all these different kids on average in diarrhea. Right? Some other well-known things pop up there too, that getting old helps, being wealthier helps, an educated household head helps, and so forth. Okay, so that was for all households. We split this sample, though, by urban and rural households, and this is a really interesting sort of capital swap story. You can see, again, just look at that bottom box. You can see that for rural households, the red triangles, it's the same pattern. Upstream activity helps, makes it worse. Tree cover upstream helps. But for urban kids, those signals go away. And this, to me, is evidence that the connection between health and nature is less important for urban kids, right? They're swapping natural capital as a source of human health for things like infrastructure and built capital. So let's talk a little bit about policy. I'm going to show you 3 quick ways we're thinking of that. One is we can actually get the marginal effects out of this model. So we can say, what's the effect on the change, what's the expected change in the probability of diarrhea among kids if you do various things? And so this is for the rural populations, a graph showing kind of stacking up potential interventions and their effects on diarrhea prevalence. So you can see that, improving wealth or education or sanitation, those all reduce the probability of diarrhea. But also improving tree cover upstream, the more you do it, the more that also decreases the probability of diarrhea, such that even a 30% change is on par with something like improved sanitation in the household, right? So it's not the most important intervention, but it stacks up on par with at least some of the traditional ones. And again, we do that same for urban, and we can see that these natural capital interventions have no significant impact. Again, mirroring that earlier result that it's a stronger connection between nature and childhood health in rural households. Another thing we can do is work with somebody like World Wildlife Fund, which we're doing as a pilot in Kenya, and we hope in priority watersheds throughout their portfolio, to ask where are children vulnerable. Our model can be used to build an environmental vulnerability index and a social vulnerability index. Where are kids downstream of degraded watersheds, and where do they lack the sort of infrastructure to insulate them from that? And we can just use a simple kind of heuristic prioritization scheme to identify watersheds where children are vulnerable in both ways, from a degraded watershed, and they lack this infrastructure to maybe insulate them from those processes. Lastly, I just want to connect this to the Sustainable Development Goals, because we heard a lot about them yesterday. And I think, in general, nature-based interventions, natural capital, green infrastructure can be a really good way to go after several Sustainable Development Goals at once. And this is a point that's been made before. Just mapping the project I just showed you onto the Sustainable Development Goals, I can come up with 6 that it addresses at the same time. 2 from the poverty kind of realm, 2 from the health realm, and 2 from the nature realm. So I really think in general, these sorts of relationships, understanding how nature and health interact, is a way of addressing sustainable development goals in bundles at a time, which is the only way we're going to make progress on such a long list of to-do items in 15 years. Okay, quick take-homes and then I'm done. Watershed condition affects children's health, and we can find that globally even after controlling for lots of the well-known mediating factors. The signal's strongest for the most vulnerable kids, and this is really important. I showed you how it's strongest for rural kids. I can also show you, if you'd like, later about we're finding stronger signals for the poorest households compared to the more wealthy ones. And as a result, I think nature investments can be seen as public health investments in the right places, in the right conditions. And we're working with WWF, USAID, and beginning with the UN to roll that out. So thanks to all these people and supporters, and thanks to you for listening.
You can come to the microphones for questions. Taylor, I omitted, and listening to Taylor reminded me, back in 2009, a small group of us got together with support from the Rockefeller Foundation, actually, to start to think about these relationships. And we had a program called Health and Ecosystems Analysis of Linkages with many of you in this room who were founding members, and Taylor's systems thinking was really an important part of that, and that is what evolved into the Planetary Health Alliance. And as Taylor said, it's become a real thing. So it's exciting. And Taylor, thank you for tying all those threads together. If conservation can be an effective public health preventive measure, so much the better, obviously.